Just infectious disease doctors and other experts in COVID are concerned that our numbers are going in the wrong direction. I'll give you a few stats and I'll let Phil tell you more about that when I turn the mic over to him. Our R-naught number, which is the replication, so if 100 people are sick, how many people will replace them in being sick, is above 1 and has been above 1 for some time. When you're above 1, it means more people are getting sick than are getting well. And so that is not good. Our hospitalizations since September 27th have increased 43% here in Dallas County. And our positive cases, our daily positive case numbers, have gone up 20% over that time period. And so we're calling on all Dallas County residents to help keep us in the orange and reverse the trend that we're seeing now, get us moving towards lower cases and the yellow, which will allow us to look at more businesses thriving and opening and more freedoms for people and better outcomes for our kids who need to be going to school. Remember that the people that are going to the hospital today, they got sick a couple of weeks ago. So the decisions that you make now in this weekend will have a big impact on what happens next week and the week after. Now this weekend is a special weekend for us here in Dallas. It's Texas OU weekend. And as you know, many people come to town, not just for the game, but for the celebrations around the game, and not just those who have a ticket, but those who come for private parties or those who already live here and get together for parties. I want you to think about this. If each person in Dallas County just has close contact with 2 more people than they normally do by getting together for some type of a celebration, that is 6.5 million more contacts than we would see on a normal weekend. So we really need to be careful on this Texas OU weekend and throughout the fall as our numbers go up. And I know right now people are feeling COVID fatigue, and you're hearing mixed messages about things getting better. They may be getting better somewhere else, but unfortunately here in North Texas, in Dallas and Tarrant and the other counties, the numbers are going up and they're going in the wrong direction. So we need to practice those 3 W's. Wear a mask, watch your distance, be 6 feet away from people, and wash your hands. The Public Health Committee is reiterating that when you have those gatherings, you try to keep those to 10 people or less, and it's the same people that you're normally hanging around with is the people that you get together with on the weekend, what have you. That you avoid those few things that are left that they say are not safe to do, large crowds, working out in indoor gyms. So what can we do? Well, at this point, we can do a whole lot. With the weather the way it is, we can take it outside. And so if you're going to get together for a family event, a birthday party, to watch a ball game, you could take it outside. You can, most of these TVs today can be, they're not hooked into the cable anymore, so we can take those outside. If you can go outside, remember your bug spray, and we strongly recommend that if you have 2 or 3 households together, and that would be hard to do, by the way, if you keep it down under 10, but for those of you who are doing that, please have them sit at their own tables. Okay, so set up a card table for one family unit that lives at one house and another card table for another, and keep those card tables 6 feet apart. For those of you who are indoors and around people outside your family, it's very important to wear a mask, particularly if you have poor ventilation, because now we know, the CDC has told us this week, that in areas of poor ventilation, COVID can linger in the air. So it's even possible, for you to walk past where someone else has been and get COVID. What is poor ventilation? Well, if you live in older housing stock, if you live in a house that's been built onto, If you live in a house where when you turn your air conditioner on in the summer or your heater on in the winter, you have a part of the house that gets colder or hotter than the other part, you likely are in a place with poor ventilation. There's a lot of poor ventilation in houses, much more so than in, say, buildings, office buildings. And so it's really important for the spacing and masking in those areas. If you must be in the house with a group of other people, let's get that fan running on the air conditioning, that setting where the air is recirculating all the time, or better still, open a window and let a breeze come through. Let's talk about voting for a moment. Oh, and by the way, before we get to voting, let's talk about gatherings. If you've got a family member who's unwell, you're not sure why, but they're unwell, then they need to not go to the gathering with the other people. And these large gatherings are strongly discouraged, especially now with our numbers going up. High-risk individuals should be particularly careful about getting around other people. And as much as possible, again, we want to stay with a group that we're regularly around and not get around new people at a time where the numbers are going up. It's always best to wear a mask. Outdoors is always better than indoors. More distance is always better than less distance. Now on voting, Tuesday we'll begin early voting. We will have on our website at dallascountyvotes.org a color-coded chart of all of the sites that are open for early voting with a green, yellow, or red light on them to let you know the greens you'll be getting through much faster than the others. And voting will be safe. In the current environment that we're in, and even back when we were in a much worse environment in July during the runoffs, we were able to do voting safely. You should not worry about going to vote. They're taking extraordinary measures to keep you safe. But we do need you to vote early. As many of you that can, vote by mail or vote early. And let me explain to you why that is so incredibly important. In the last presidential election, it took people 5 to 7 minutes once they got to the front of the line to cast their ballot and leave. That's because 2/3 of them used what's called straight party voting. That means they just clicked one button and they were done. That is no longer allowed in Texas. And so now you have to vote on each individual race, all right? And so that will take longer. Plus, many municipal elections that would have normally happened in the summer have been pushed because of COVID to November. So we estimate that it will now take people 11 to 13 minutes to vote. Well, that's twice as long. If we have 40% of our votes show up on election day and they have to be 6 feet apart, then lines will be very long. It'll be very difficult to get that done. But if people will vote early so that number goes down for election day to a much lower number than we're used to seeing, then everyone will have a good voting experience and get in and out of there in a reasonable amount of time. So please make a plan and please go vote. I mentioned yesterday about bars. I feel really, really bad for bar owners, for bar employees, in particular for them, but for all of the businesses that have been damaged by this terrible pandemic. What would it take for us to be able to take a look at opening bars? It takes our situation improving, getting into that color chart out of orange going the other way. And so how do we do that? We make good decisions as a group, and that's one of those things that can get opened up if we can get sufficient improvement to satisfy the medical experts. And it's really up to all of you to make that happen. I know that was a tough thing, but that was a unanimous recommendation from our health experts. Now I want to talk to you about Halloween. This is very important. If all of our kids go out and they trick or treat, this is what the doctors are telling us. It's unlikely that every door that is opened, the person on the other side of that door, whether it be the trick-or-treater or the homeowner, will have appropriate masking on. Our kids will be hot, they're excited, they're not going to be 100% compliant with masking, at least not all the kids will be. So we're strongly encouraging, along with the CDC, the local doctors are strongly encouraging you to consider alternative Halloween celebrations. So taking a page from Easter, where we have Easter egg hunts, you could have a candy hunt at your house. You could have a age-appropriate family Halloween movie night after that. You can do pumpkin carving as a family, similar to how we've done some people have done birthday parties. You can have drive-by costume, caravans where families stay in their individual car. It's what you can do to make fun for your family and make this a memorable holiday is just only limited by the imagination of the people. But staying away from trick-or-treating, because even in 1918, when they had the flu pandemic and they did so many things wrong, the President of the United States told people not to go trick-or-treating. So that's what the CDC is saying now. Don't go trick-or-treating. Don't trunk-or-treat. This is where you're outside and the candy's in people's trunks or somewhere else and you go from place to place getting candy. They're saying don't do that. And older kids and young adults don't have big Halloween parties. I feel like the Grinch sometime up here telling you all the things the doctors say are unsafe to do. But if we want our businesses to thrive, our people to stay healthy, and our kids to get back to school where they need to be for their mental and educational health, then we've got to follow the doctor's recommendations on these things. Let's see what else I've got before Phil shows you the numbers. We got Halloween, here's some other things, Halloween themed meals and preferably outdoors or at a patio of a restaurant, Halloween themed decorations, although that may confuse people to knock on your door that do go trick-or-treating. And by the way, if you don't have small kids, the best thing to do for Halloween for you to protect yourself from COVID and protect kids from COVID is just turn that light off and don't answer the door for the early evening on Halloween. It's no fun, just like it's no fun not to party like we normally do in big crowds for Texas OU weekend, but yet it's what's necessary so we can keep the numbers down going into Thanksgiving and Christmas, and keep the numbers down so our kids don't take COVID back to school and close schools down. Lastly, I want to talk about housing assistance. As many of you know, the President broke off negotiations with Congress to provide more assistance to people and said he will not reinstitute those negotiations. So there won't be additional relief as we had all hoped for housing relief. However, housing assistance is still open in the county. So if you're in the city of Dallas, you go to the city of Dallas's website. I believe it's dallascityhall.com. If you're in the city, or if you're in any other city in Dallas County, you go to dallascounty.org and apply for that housing assistance. And that is still available from us locally. Those who apply will also be able to, when they apply for that, even if they don't get it, that makes them eligible for eviction protection until the end of the year. So that will qualify you under the CDC order. Just merely applying for housing assistance will do that. And if you get it, that'll help you pay your rent and help your landlord get some money in. So again, for more information, you can go to dallascounty.org. And now I'll turn it over to Dr. Huang. Hang on one second.
Good afternoon. I just have a few things to share. We are reporting 238 new positive cases today, includes 198 confirmed cases, 40 probables, and we are also reporting 4 deaths. I just wanted to reinforce and show you some of the numbers, why, as the judge mentioned, we're where we are and where we're concerned right now. As he said, we are in the orange zone, and we were very pleased to be able to get out of red and go to orange during September. Next slide. And when we've been monitoring the ICU bed availability, this has been something, this shows, again, the number of available beds, so this is something that we don't want the number to go down. And unfortunately, we've stayed down, and it's been plateaued and stayed down at that lower availability of beds without going back up. And part of that reflects that there was a period when people were avoiding the hospital because of COVID. So some of the normally the reasons why people occupy the ICU beds, they weren't coming to the hospital, but now they're coming back, and so we are seeing that the occupied ICU beds still being relatively low. Next slide. But this slide really shows sort of the whole course of what we've been dealing with and why we're concerned. In particular, this is the number of suspected and confirmed emergency department visits in the prior 24 hours. Thinking back all the way back to early March when we had no cases and we had no people going to the emergency department with suspected or COVID. Then we went, and recall it was in mid-March first implemented the stay home, stay safe. We flattened the curve in that it went up, but the numbers visiting the emergency department went up, but then they stayed flat through April and through May. But then we recall Memorial Day is when the state opened up things. I think all of us were tired of doing everything we were having to do, and things were opening up, and that's when we saw really the exponential increase, and it's reflected in that big upsurge in the numbers. And you'll recall this is then when we started to get 1,000 new cases reported for 18 days. But then right before July 4th, we said we could not have another Memorial Day weekend over July 4th weekend. And right before that is when we had found the mechanism for first implementing universal masking, and then the state issued the universal masking orders, as well as closing the bars. And that's when we saw, after that, the declines in those numbers of emergency department visits. It continued to decline. We did see a slight bump from Labor Day, but it's been declining. And now what we're concerned about, you can see the last 2 weeks at the end, back into this chart. Now we're starting to see it's going back up again. And this is what's concerning to us. We know that when it takes off and when it starts to go up, it can go up really quickly. And then it takes a long time to come back down. So let me go through just a couple of the other things that we're monitoring, but they're all showing this starting to go back up after being down. This is the number of confirmed admissions to the hospital in the last 24 hours. And again, you see that decline that we saw from end of July through August into September, then the flattening out. And now as we're getting into October, it's starting to go back up. Next slide. This is the number of confirmed inpatients. So this includes in the general hospital beds as well as the ICU beds. Again, some of these lag some of those initial indicators, but they show that same decline through August, then flattening out in September, and now the tail end of this curve, we're starting to go back up again. Next slide. This is deaths. Now this is one thing, and part of this may reflect, there's still some lag in our death reporting. Also may reflect some of the difference in some of the people that are getting sick, younger populations perhaps reflecting some of the cases that we're getting in the new numbers. The deaths have not yet shown that upward trend, but then those again lag behind all these other indicators, so we're still watching to see what that does. And then last, I have just a slide. This is specifically, again, we look at multiple data sources. We work with the modelers from the different hospital systems. We work with the academic centers and look to see various indicators and see if they're all pointing in the same direction. And that gives us more confidence that what we're seeing and what we're projecting is the actual truth. This is specifically Parkland Hospital. Again, the lab confirmed emergency department visits, week over week growth rate. So they look at how the prior week, that ratio of the prior week to the current week goes. You can see if it's over a 5% increase, so and you can see the Stay Home Texas back in March, April, how it slowed things down. That blue line sort of shows the average trend of this. Then it starts, we were seeing it flatten out. Then you can see the county masking order. Then you see the state chain store mask, or the national chain store masking order. It goes down even further in the statewide masking. Then you can see that upward curve now again, where it's going back up. You're seeing DISD opening and the schools opening. Again, that's what we're concerned about as we're seeing this upward curve back up, because this is at the same time that we're having schools open, that we're having colleges come back, that we're this starting to get cooler. We know with more cooler weather, people are going to be spending more time indoors, which is, the judge said, it's outdoors is better than indoors, but if more people are spending time indoors, then that's concerning. All these factors combining then that make it much more volatile, that if we're already seeing this upturn, that it may be continuing. So it's so important, and we can determine, we've seen we can make an impact on this. It is so important for everyone to stay the course and be vigilant on the universal masking, the 6-foot physical distancing, the hand washing, the not touching your eyes, nose, and mouth, the stay home, the teleworking, and keeping away from crowds. All of those things we've shown can make an impact, and if everyone can continue to do that, we want to keep it in the right direction, but we're seeing indications it's going in the wrong direction. The only other thing I just want to mention, we've mentioned that it would be really bad also if we have a bad flu season. We have a vaccine for the flu. We have it available. Get your flu vaccine now. I know that even though we're having some distribution problems and some delays in our shipments, there are shots available at Ellis Davis Fieldhouse, at Eastfield College. My understanding, there are no waits. People can go there. If they don't have insurance, you can get a free shot. Go there today, tomorrow. There have not been long lines. You can get those shots. In the meantime, we're still also waiting for some of the other shipments to come in, but we have them available now. If you have insurance, you can go to the drugstore or the grocery store or retail stores and get the shots. So they are available. We strongly urge you to get those shots also. So I think that's all that I have.
Any questions from anybody? Thank you, everyone. Oh, one quick cool thing about the flu shots at Ellis Davis and Eastfield, you don't even get out of your car. You just drive by, stick your arm out, we give you a flu shot. Thanks, guys.